الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. اللهم أخرجنا من ظلمات الوهم وأكرمنا بنور الفهم وافتح علينا بمعرفة العلم وسهل أخلاقنا بالحلم. آمين وأجمعين. اللهم ارزقني نعمة الإخلاص لوجهك الكريم بكل ما أقول وبكل ما أفعل. Here we have today the last in your last spot cases session, and we include the neuroradiology spot cases. I have about 50 to 55 cases in this session, and also there is a certificate of attendance. I will share it in the YouTube and also the Facebook. Please don't forget to fill the link and the required field to receive the certificate in a few minutes. Here you can take some moments, about 10 to 20 seconds, and see what do you think about this case. Here we have mass lesion and we have a dual tail sign, and this is patient has meningioma with a dual tail sign, and the dual tail sign, it is seen in about 60% with meningioma, and also have been seen in non-meningioma tumors. Here, this is our next case, and we take a look for this case and try to recognize what is the diagnosis. As we see here, we have subarachnoid hemorrhage and involving the suprasellar cistern and also around the bones. And this is also, we have patient have dilatation of the temporal horn suggestive of hydrocephalus. So this patient has subarachnoid hemorrhage with hydrocephalus. We move to the next case. This patient is 32 years old, postpartum. What do you think the patient has? Here we have FLAIR images and the selected slices of the brain from the below the lateral ventricular bodies to the cortex, and we have bilateral symmetric hyperintense vasogenic edema in the parietal, occipital, and frontal lobe, and also some of the basal ganglia. And this is a classic of breast. This is a classic of breast. We move to the next case. Here, what do you think of this child has? I think I present this case in the pediatric imaging. Okay, we have this patient has a closed lip schizencephaly, and here you see it is the closed lip. It is lined by gray matter, not white matter. If it is lined by white matter, so this is not a schizencephaly. It is a poencephalic cyst. Here we move to the next case. What do you think of this patient has? This is 59 years old male with altered mental status and syncope. What do you think the patient has? We have, as we see here, the patient has abnormal signal intensity, low in T1, high in T1, high in T2, and this is a classic example of, this is a classic example of osmotic demyelination syndrome, formerly called, it is called before as central pontine myelolysis. This is the new name, it is osmotic demyelination syndrome, and the previous name, it is called central pontine myelolysis. We move to the next case. What do you think the patient has in this next case? Okay, as we see here, this is T2, and we see here subependymal heterotopic gray matter adjacent to the left occipital lobe horn and iso-intense to the gray matter. So this is subependymal heterotopic gray matter adjacent to the left occipital horn. What do you think the patient has? This is a classic. This is ice cream on cone sign, and this is a vestibular schwannoma on the right side. It is vestibular schwannoma on the right side, giving the appearance ice cream on cone sign or appearance. This is vestibular schwannoma. Axial T1 with contrast, it is enhancing. What do you think this patient has? Here, this is a bone window, and the patient has osteoma of the mastoid. And what do you think the syndrome called? Can you remember the syndrome associated with the skull osteomas? This is a mastoid osteoma. Please remember the syndrome associated with osteoma. What do you think the patient has here? It is a spinal cord ependymoma, as we see here. It is, and there is a cap sign, and this is a cap sign, and this is spinal cord meningioma with cap sign. The cap sign, it is in the T2, we see hemosiderin either below or above the tumor. And this can be seen in the other pathology like hemangioblastoma, paraganglionoma, and arterial malformation. Okay, we move to the next case. What do you think the patient has? Okay, we have bilateral calcification as we see here, and this is a classic optic edrusion. It is a classic optic edrusion. Okay, what do you think the patient has here? we have this patient has optic nerve meningioma, as we see here, with calcification, and the radiological sign, it is a tram sign. So this is optic nerve meningioma with tram sign. We move to the next case. What do you think the patient has? This is T2 flare, and what do you think? This is in your cysticercosis, and this is a vesicular stage. We have 4 stages of neurocysticercosis. We should know the stages of the neurocysticercosis. Okay, we move to the next case. What do you think the patient has? This is coronal T1, and this is enhancement, and this is T2. And we see small cyst here in the right side of optic chiasm. It is the small cyst not enhancing, and it is cyst of the optic chiasm. Okay, we move to the next case. What do you think the patient has? This is classic. This is molar sign and molar teeth sign, and this is a Jovart syndrome. Okay, we move to the next case. What do you think the patient has? We have venous angioma in the left frontal lobe with prominent cortical vein and small collateral veins toward the frontal. This is a venous angioma. What do you think the patient has here? We have, in this patient, we have a persistent trigeminal artery and fetal origin of the posterior cerebral artery. This is persistent trigeminal artery. You see it is arising from the anterior carotid and go to the basilar artery. And also we have persistent fetal posterior cerebral artery. Okay, what do you move to the next case? This patient, 80 years old, woman with right involuntary movement in the right lower extremities. What do you think the patient has? We have, this is T1, and we have high signal intensity in the T1, and this is a classic patient with a diabetic called hemichuria hemibalismus in non-ketotic hyperglycemia. Then this is hemichuria hemibalismus in non-ketotic hyperglycemia. What do you think the patient has in this patient? And we have patient mass in the splenum of the corpus callosum associated with vasogenic edema, and the mass it is not enhancing, and this is and no significant midline shift, and this is gliomatosis cerebri, and this is a rare diffuse neoplastic process of the brain and has poor prognosis. So this is a gliomatosis cerebri. What do you think the patient has? This is patient, what you think the patient has in your patient. We have bilateral symmetrical hyperintense signal changes in the anterior medial globus pallidus with surrounding hypointensity on the T2. And this is due to Haller-Warden Spatz disease, or it is also called bantothynate kinase associated neurodegeneration. So this is bantothynate kinase associated in neurodegeneration. Still, previously it is called Haller-Warden Spatz syndrome, and the sign here it is eye of the tiger, eye of the tiger, or tiger eye sign. Okay, we move to the next case. What do you think the patient has? The patient has, in this case, we see a cystic mass in the fourth ventricle with some hyperintensity, and this is representing the scolex, and this is a case of neurocysticercosis, and this is vascular. This is a vesicular stage, and you should. There is also hydrocephalus, and you should know the stages of the cysticercosis. We move to the next case. What do you think the patient has? This patient has cerebellar atrophy and also hot cross bun sign, and this patient has multiple system atrophy. Multiple system atrophy. We have two types of multiple system atrophy. We have the C type and the B type, and this is the C type, who are cerebellar atrophy. The other type, it is predominant Parkinsonian signs and symptoms. Okay, we move to the next case. What do you think the patient has? This is simple. What do you think? We have cyst in the right side with restricted diffusion, and this is a classic epidermoid cyst in the right CB angle. Classic epidermoid cyst in the right CB angle. We move to the next case. What do you think the patient has? This is child, and what do you think? This child has signs of intracranial pressure manifested by suture widening and cover beaten appearance, and we should search for the cause. Okay, we move to the next case. The patient here has normal variation, and this is large Haller cell associated with medial deviation of the ipsilateral uncinate process. The medial Haller cell with medial deviation of the ipsilateral uncinate process. This child has classic appearance, and you see multinucleated subdural collection, and this is embyema, subdural embyema, and this patient has bilateral subdural hematoma, bilateral subdural hematoma, iso-intense to the brain. And this patient has, what do you think the patient has? This is ultrasound coronal view, and this patient has bleeding in the right caudothalamic groove and rupturing to the ventricular system with hydrocephalus. And you should know also the grading of the hydrocephalus. Once it is reaching to the intraventricular, it is in type 3 or stage 3 or grade 3, and as we see here. Here we have a patient with ring enhancement with restricted diffusion and low signal intensity in the ADC map, and this is a classic of brain abscess. This is a classic of a brain abscess. This patient has multiple hourglass deformity, and this is a classic patient with spinal canal stenosis. This is spinal canal stenosis. And we see the disc are diffuse in signal intensity with some modic changes here. Here, this is another patient. What do you think the patient has? Here we see the patient has posterior longitudinal ligament ossification, posterior longitudinal ligament ossification, and can be associated with dish. And also we have a fusion of this vertebra and this vertebra 2, 3, 4, 5, 6, and possible fusion in the 6, 7 also. And this, it can be associated with dish in some percentage. I don't remember, but I think it is about 30%. Okay. The next patient, what do you think the patient has? This is a patient has popcorn appearance, and this is a classic of cavernous malformation. And here we have the imaging modality imaging of the cavernous malformation. This patient has a simple case. This is a simple case. We have hangman fracture with forward displacement of C2 over C3 subluxation. This is hangman fracture. On the MRI, also we have a spinal cord contusion. Okay, we move to the next case. What do you think the patient has in the next case? We have the patient has ethmoid cell mucocele, as we see here, thinning of the wall, and here erosion of the wall. And this is expansile mass in the ethmoidal sinus. Hypoattenuation consistent with mucocele, pushing the orbit laterally and superiorly. We move to the next case. What do you think the patient has on the next case? We see in some of the previous examples, we see the closed lip schizencephaly, and here we have open lip schizencephaly. And as I said, this is lined by gray matter, lined by gray matter. And if it is lined by white matter, so this is not a schizencephaly. This is a borborygcephalic cyst. So this is lined by gray matters. This is open lip schizencephaly. Here, this patient has CT and MRI at the same levels, and we have in the CT scan multiple metastases, also seen in the MRI, but in the CT scan, it is sclerotic metastasis. You should know the differential diagnosis of sclerotic metastasis. We move to the next case. Here we have the basilar artery, and this is the vertebral artery, and this is a basilar artery fenestration. Basilar artery fenestration. Okay, this is the basilar artery fenestration, posterior cerebral artery, posterior cerebral artery. Okay, we move to the next case. What do you think the patient has? Yeah, as we see here, this is a classic of anterior communicating artery aneurysm. Anterior communicating artery aneurysm, as we see here. Here, what we have in this patient, we have bifacetal cervical spine subluxation or locked, and also we have a spinal cord contusion and also contusion in the soft tissue with hemorrhage. Here we have this patient has CT scan and we see bilateral spondylolysis in this patient or pars interarticularis fracture. So this is a pars interarticularis fracture or spondylolysis. Okay, and this patient has, as we see here, diffuse hypodensity involving the brain with sparing the posterior fossa, and this is hypoxic brain injury, diffuse hypoxic brain injury, and this is white cerebellar sign. Diffuse hypoxic brain injury. This patient has, we have soft tissue window for the brain and bone window to the brain, and this patient has tension in pneumocephalus, and the sign, it is Mount Fuji sign. This is the Mount Fuji sign, as we see here, and this is tension in pneumocephalus and should be operated immediately to remove the tension in pneumocephalus. Okay. We move to the next case. This is next case. We have bilateral frontal epidural hematoma. Bilateral epidural hematoma in the frontal regions bilaterally. As you know, the epidural hematoma crosses the midline. Subedural hematoma doesn't cross line. Subedural cross the suture, but epidural hematoma not crossing the suture. Okay, this is important. And this is another case. What do you think the patient has? We have this patient has large metastasis involving the bone and is involving the soft tissue in and outside the brain and the soft tissue. And this is metastasis. What is the commonest cause of metastasis to the brain? Okay. Okay, next case. This patient has non-visualized internal carotid artery from its origin. You see here, this is the internal carotid artery on the left side, and on the right side, we cannot see it. This is the vertebral artery, and this is the external carotid artery. No internal carotid artery on the right side. What do you think the patient has? We have this patient has Arnold-Chiari malformation and syrinx. Arnold-Chiari malformation and syrinx. Okay, what do you think the patient has here? This woman come to the ER department with recurrent headache, and this is CT scan. This is MRI for this patient, and we see in the MRI a patient has mass lesion, and in the course of the middle cerebral artery, and this is with pulsating artifact and has eccentric concentric internal T2 hypointensity and does fill with contrast. So this is circular right middle cerebral artery aneurysm. Right middle cerebral artery circular aneurysm. What do you think the patient has here? Compare the eyes. You see the eye here, it is okay. And the eye it's here, it is bulging posteriorly. And this is a coloboma. And also you should know what at least one or two syndromes associated with the coloboma. And one of them, it is aniridia, but the patient here is, the lens are there. Okay, what do you think this child has? 2 months with infection of the left orbit. What do you think of left eye? We have cystic mass with peripheral enhancement, as we see here, and pushing the orbit. And this is dacrocystocele, hemangioma, dacrocystocele. Sorry, this is a dacrocystocele. These are the differential hemangioma and dermoid cyst. And as I said, this is enhancing peripherally, and this is a dacrocystocele. So this is the differential hemangioma, dacrocystocele, and the dermoid. And once it is enhancing here at the periphery, it is dacrocystocele. Move to the next case. What do you think the patient has? This patient has breast cancer. And what do you think the patient has? We have a drop metastasis, droplet metastasis in the spinal canal. As we see here, this is T2. And I said in the history, it is a breast cancer, and this is the metastasis from the breast cancer. Also, other metastases can be seen. Okay. What do you think the patient has here? This patient has lipoma, as we see here, and associated with dysgenesis of the corpus callosum. This patient has lipoma with dysgenesis of the corpus callosum. What do you think the patient has in this patient? As this is patient has facial pain. What do you think the patient has? It is 24 years old. As we see here, there is elongation, stylohyoid ligament on the right side compared to the left side, as we see here, here, and there. And this is Eagle syndrome. This is an Eagle syndrome. What do you think the patient has? As we see here, the patient has ectopic thyroid, posterior thyroid, ectopic pituitary posterior lobe, and also we have a small pituitary gland. So this is ectopic pituitary posterior lobe and pituitary gland. It is small, as we see here. Okay, we move to the next case. The patient has history of seizures. And what do you think the patient has? We have high signal intensity seen in T1 and in T2 in the bulvinar of the thalamus, seen in the T1 and FLAIR images, and seen in T1 and T1 after contrast, and not well seen on the T2. And there are some differential here. We have Fabry's disease, liver failure, Wilson disease, and Jacob disease, and this is Fabry's disease. Okay, this is probably the case we see it before in this series, and this is, as we see here, selective angiogram of the right internal carotid artery, and shows a large middle cerebral artery aneurysm. Here, this, what do you think a patient has? What is your diagnosis? Okay, we have ventricular calcification and large mass in the region of the foramen minor, and it is enhancing with hydrocephalus. And this is patient has tuberous sclerosis with giant cell tumor, giant cell astrocytoma. We move to the next case. What do you think the patient has? We have mass lesion, enhancing, tortuous vein above, as we see here, and hemosiderin cap seen in the T2. As we said, this is myxopapillary ependymoma of the phylum terminal. Myxopapillary ependymoma of the phylum terminale. And thank you very much for listening, and hoping to see you soon, inshallah, in another talks. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك.